everyone, and welcome to another special episode of Mental Health Matters with Dr. Matt Gloviak. In this episode, I wanted to take a few moments to focus on anxiety and post-traumatic stress disorder in the face of COVID-19. And as we discussed earlier, there is a lot that's going on in terms of the uncertainty of what we're facing here with COVID-19 that's led to an entire array of different mental health disorders and considerations that we really need to think through to be able to have ourselves in the healthiest position possible. Now, first and foremost, there's always a significant fear in where exactly is this disease going to go? How many people are going to get sick? How many people are ultimately going to pass away? There are worries in terms of how am I going to be able to supply the appropriate types of basic needs that I need for my family when everything's running out of the grocery store. There are concerns that perhaps your medications are going to be unavailable at this time because there are places where it's hard to be able to find the appropriate stock and you can't even get into the store to be able to receive what you need. Many companies are shutting down right now, and in the wake of that, individuals are left unemployed or being laid off. And now the next worry is, how am I going to be able to afford to survive over the weeks that come? Individuals now with social distancing are being distanced from their loved ones, particularly those who are now under quarantine in the nursing homes, worrying about their well-being and what's going to happen, as well as not being able to have the communication with them. Many individuals have had work trips and other recreational activities canceled, and the list goes on. Unfortunately, a lot of the things that I would recommend right now for mental wellness are not currently available, and that is why it's ever so important to recognize what's going on with you and do something about it should you feel that you're experiencing any type of anxiety, post-traumatic stress disorder, and so on and so forth. Now, as we know, anxiety is something that generally pertains to having a worry about the unknown in the future. And for individuals who haven't even had a diagnosed anxiety disorder in the past, many of us are anxious and are starting to show familiar type of symptomology. And we take a look at post-traumatic stress disorder, which is something that occurs in the wake of an extreme type of stressor. We can see many individuals having extreme reactions to what is happening. So how do you know whether or not you are an individual who does need to solicit appropriate mental health support? First and foremost, you know yourself. If you notice that something is off in your behavior, perhaps you're worrying a lot more, perhaps you notice physiological types of differences, you have racing type of mind, you're very confused, you're frustrated, you're sad, and so on, that may be an indication that it's important to speak to somebody. Listen to your loved ones and friends and other people who know you quite well. If they're pointing out to you that there's been a change in your behavior and your attitude, that's an indication that there may be something that's going wrong. With that, it's important to be able to solicit the appropriate type of mental health services that you do need. Now, here in this time, I know that mental health services may seem as though they're limited. However, I can tell you that a lot is being done at both the state, federal, and local level at this point. Again, I've been saying it again and again because it's so important that everybody does utilize these resources, but there are still many mental health clinics that are open for face-to-face services where you can go in and speak to others. There are many that are now offering telemental health type services where you can go in, log into your computer and be able to speak to somebody online utilizing a video platform or be able to make a phone call. There are many other services that also provide crisis type of counseling where you can make a phone call to somebody right then and there, where if you do feel as though you're going to harm yourself or somebody else or can't take it anymore, it's an acute type crisis, you could speak to a professional right there in the moment who could be able to talk you down. And for those of you who are feeling too anxious to be able to actually make the phone call, there are different text services in that you'd be able to utilize to be able to just send a quick message and get an appropriate response. Now, for those of you who are looking for some type of group support, while yes, many groups are actually run face-to-face, there are many online support groups that you can actually utilize that you would be able to find online. And fortunately, many of those are free. Same thing with the national and local types of hotlines, the text messaging, and so on. All of these are free services. So with that being said, it's important to reach out accordingly and don't allow cost to be a factor because free support is better than no support whatsoever. Another thing I strongly encourage, while not everything is is known about this outbreak and what's going on. There is a lot of misinformation out there. However, whether it's something that's intentional or something that's unintentionally being given, what we do know is that the dynamic of the virus and the way society is responding to it is continually changing. So if you find yourself being worried about everything that's going on, again, embrace yourself for the reality that none of us actually know what it is that's going on. However, in the wake of this uncertainty, it's important that you do take care of yourself. Utilize the appropriate resources. In social distancing, make sure that you still are reaching out to other individuals through whatever type of means possible. Try to refrain from excessive substance use, as I know many people now who are home, whether unemployed or staying home with the kids and can't go to work, are starting to rely on more recreational drug use, alcohol consumption, and so on. Don't fall prey to those types of negative type of coping skills. So again, seek the appropriate help that you need. Engage in activities that you find worthwhile, such as listening to music, reading a book, watching your favorite movie, trying to work out at home. Get out where you can, not putting yourself in dangerous types of situations, but even if you can go outside, take a walk around the block, those different types of things can go a long way. So although a lot is changing right now and we don't know what's going to be happening here in the future, there is a lot that you could do to take care of yourself right now. Again, you know yourself better than anybody else, and if you notice even the slightest of change, it's important to go out there and speak to somebody. I strongly encourage it. You're more than welcome to reach out to any of the resources I'm providing here, both in this video as well as what I'll post on the Facebook page of Mental Health Matters, but also feel free to reach out to me as well at dr.mgloviak@gmail.com. I wish all of you the best in both physical and mental health, and I hope to speak with you again soon. Thank you.